Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, then we have cardiac manifestations of SLE. So, cardiac features of SLE. In the SLE, the most common cardiac manifestation is pericarditis. Pericarditis is the most common cardiac manifestation of SLE. The patient can develop endocarditis, especially Liebman-Sachs endocarditis can develop in the patients with SLE. The patient can develop aortic regurgitation is common along with the mitral regurgitation is also common in patient with SLE. Then there is risk of myocardial infarction is seen with myocarditis, and endocarditis are also seen in SLE. So the most common cardiac manifestation of SLE is actually the pericarditis.
thank you and thank you for watching.